Clearly, both parties want to accomplish the same goal, which is to improve the state of healthcare in the country, better healthcare services, cheaper costs, and fewer people uninsured. As the Democratic and Republican leaders of your respective organizations on campus, why do you think our leaders in Washington are having such difficulty deciding how to reach this goal of ours? And what compromises can and should we make on each side? Austin, we'll have you go first.
Well, there are three reasons why I think this is a hard issue for people to come to terms with. The first is that there are deep interests entrenched, and they fight and they spend money to make sure that the status quo remains. We've been having this debate for 100 years. We've been having this current debate for 20 years, and we finally did something about it. Number two is that it's healthcare. These are people's lives. It is supposed to be a hard problem. It's something we feel emotional about, so that's why it's so hard. The third is that the goalposts keep moving. The Republicans used to be far more liberal on this issue. Nixon was for a full employer mandate, which the Affordable Care Act does not provide. Bob Dole had the individual mandate, which is part of Obamacare, in his Republican alternative to the Clinton proposal in the 90s. The individual mandate was a Heritage Foundation idea. So the Democrats keep saying, okay, we'll compromise, we'll take these Republican ideas, and then the Republicans kept moving the goalposts and wouldn't agree to a deal.
Carlos, your thoughts?
And I definitely agree with some of what Austin has said. We do recognize that there's a lot of interests that play into not only healthcare policy, but government policy in general. And that's my main point. Things are hard, especially a complex healthcare economy for one of the largest countries in the world. So because it's hard, I would just echo some of the ideas that Ayn Rand and Frederick Hayek and Milton Friedman said when they were alive, and told us that central planning these things is not going to fix our problems. Having a central board hundreds of miles away trying to fix somebody's individual health care in California or in Buffalo, New York, or in Seattle is not the answer, because they're not there. There's no local knowledge. There's no face-to-face interaction. It's just more bureaucracy, more laws that are restrictive and prevent the market from actually becoming free and solving these problems. My compromise, and I think what a lot of the Democrats and Republicans should recognize, is that it's not only that it's inefficient to run it from Washington, but that it's impossible. We need to bring it back to the states where people know their legislator, where people can make change a little quicker, where people can move from state to state. If California wants to have a full welfare system where everybody pays for everybody, they can have that and have the consequences from that. If Arizona doesn't want to have that, people should have the right to say and reject it. But it's only separating it and having the states be the laboratories of innovation for laws on healthcare and the economy that are going to help us come up with a solution, not centralizing it in Washington, D.C. with the Obama administration.